Thanks everyone for joining us today at our Policy and Advocacy Information Session. My name is Carly Mosby. I'm with Kentucky Youth Advocates. And during today's forum, we just ask that you stay muted, but we are going to take questions and comments in the chat feature, and we'll try and answer those as we go, either in the chat or afterwards. So feel free to use that chat feature throughout this forum. So today you're going to learn more about the Blueprint for Kentucky Children policies and hear from some of our Blueprint partners about 2021 policy priorities and why we need you to be an advocate for Kentucky kids. So now I'm going to turn it over to our partner co-host so that they can introduce themselves and just share a little bit about their organizations. So we'll go ahead and start with Dr. Howard. Would you like to go?
Hi, yes, I am Christina Howard. I am a child abuse pediatrician at the University of Kentucky. So a lot of people don't even know that child abuse pediatrics exists. Unfortunately, we all know that child maltreatment is one of the huge adversities that are affecting Kentucky's children, and we stay very busy. And so it is an additional training that is required for a pediatrician to get board certified in child abuse pediatrics. And so we have a large interdisciplinary team at UK. Or it's ever growing, I guess. It's never enough, it seems like. But we have child abuse pediatricians, we have forensic nurses, and we have social workers and nurse practitioners that are all part of our team that get involved in assessing a child when there's concern of child maltreatment. So we've been involved in identification of child maltreatment. Of course, prevention is always our passion. We want to put ourselves out of a job. But then I think the biggest thing too is one of my favorite quotes is, adversity is not destiny. And so once we identify child maltreatment, we need to be able to intervene in the lives of the children so that they can become resilient despite having experienced ACEs. And that means, that 3-month-old that we saw last week with 5 ACEs already, how can we help them and their family? And that is why we have to rely on our community partners. And so I have worked with Dr. Spring, both clinically and through FACE at Bluegrass. And then Jennifer Hancock, I worked with quite a bit when I was actually in Louisville. And so they both play a role in how we help our families and how we help our children. And so I'm going to let Jenny or Dr. Spring now talk about her work at the Center on Trauma.
Thank you, Christina. So I'm so happy to be here celebrating Child Advocacy Week. I am Jenny Sprang. I'm a professor of psychiatry in the Department of Psychiatry at the University of Kentucky, and I run the UK Center on Trauma in Children. And so some of you may know about our center. We are a translational research center. What that means is we've got a couple of clinical enterprises or labs that we call them. One is a forensic risk assessment lab. So we kind of pick up the case after Dr. Howard has done her investigation. We're basically looking at, is this family safe for kids to go back into once an open case is established. We also have a federally funded trauma treatment center where we're bringing evidence-based trauma treatments to Kentucky, like TFCBT, and child-parent psychotherapy, and child and family traumatic stress intervention, and Target, and other evidence-based interventions. And then another big piece of our center, beyond research, of course, is systems transformation, trying to make the child-serving systems in our state more trauma-informed, more secondary trauma responsive, because workers can't really apply trauma-informed principles if they've never been applied to themselves. So we're really promoting that and just building the community's capacity to treat kids that have been abused and neglected and exposed to other kinds of trauma events. So I'm really happy to be here. And Jennifer Hancock, I will pitch it over to you, and I'll just say that Jennifer and I go way back. Jennifer actually was like this outstanding, amazing student of mine, which really puts date on me from, I don't know, what, 20 years ago. You were a student of mine, and so appreciative and amazed at the work that she's doing in the community as well.
Well, thank you so much, Dr. Spring. I told Courtney Downs last night that I would be fangirling all day today at the thought of being on this panel with you and Dr. Howard, two Kentucky leaders that I admire so much. So thank you. And good afternoon, everyone. I'm with Volunteers of America. I'm a licensed clinical social worker who had the privilege of being grown up by Dr. Spring at the University of Kentucky. And I started my work back in the 90s, working with families affected by substance use disorder at Chrysalis House in Lexington. Really cut my clinical teeth and fell in love with a population of women who simply wanted help from this terrible disease of substance use disorder, and they were tired of being punished. And fast forward, I've now been at Volunteers of America 14 years ago yesterday, and feel truly humbled that we get to do some of that same work in Jefferson County and now in Clay County, Kentucky. We have opened our newest Freedom House program in Clay County 11 months ago. On March 13th, we accepted our first family. And that day was the day that the pandemic became really real in Kentucky. And we did not allow that to slow us down. We were able to bring on staff who were committed to this mission and committed to really being frontline heroes and ensuring that every family who needs access to those types of supports gets them. And we have remained full every single day, and now have a waiting list. We're focused on expansion. We have a research grant through SAMHSA that we're partnering with UK on that's allowing us to serve an additional 250 families in southeastern Kentucky over the next 5 years. So we're excited about that expansion. We've brought 30 new jobs to the region. We've made $10 million of investments to be able to create a recovery ecosystem, really targeting those families who are most vulnerable, who need recovery housing, workforce reentry, a family recovery court that will soon open there. That's a Department of Justice funded program. So our organization remains committed to partnering on the ground with local communities who identify they need some additional supports. And we're eager to continue looking for ways to bring our mission to life in some of these parts of Kentucky that are under-resourced and overwhelmed by families who are struggling with substance use disorder.
So much, Jennifer, and thank you to Dr. Howard and Dr. Spring as well for your all's introductions. So just to kind of get our brains going and give us an opportunity to kind of connect with one another, we're going to do a few polling questions. So I'm going to launch this first poll. And it says approximately how many kids live in Kentucky? So what do you all think? How many kids do you think live in Kentucky? Give it a minute or two for folks to weigh in. All right, so I'll share these results. So yeah, so we have, the answer is over 1 million. So the exact number based on 2019 data is 1,275,481 kids that live in Kentucky. So the next question is, all of you today are advocates for kids, of course, we know that. How long have you described yourself as an advocate? All right, so we definitely have some longtime advocates on here. So as you can see, we have 51% of the folks on this call for more than 10 years have been advocates. So that's great. And then we have a couple that are kind of new to the role. So hopefully we'll give a good, give some good information for everybody during this forum. Okay, next question. how many children's advocacy days have you attended in the past? So it used to be Children's Advocacy Day, and this year's Children's Advocacy Week. So how many have you attended in the past? All right. So it looks like this one's a little bit more varied. So we have this for a few people, about 26%, this is their first Children's Advocacy Week or Day. So that's great. We're really happy to have you all, you first timers here today. And we've got some others here as well that are kind of more veterans to our Children's Advocacy Day events. All right, last one. What advocacy action are you most proud of? And feel free to give us a little more detail in the chat. Or if there's one on here, or if there's one that's not on here, provide that in the chat. Right. So it looks like the overwhelming majority is being there for a child when they're struggling, which is super duper important, but also just built support for policy change among friends, family, and colleagues as well. So those are the two big ones on that one. All right. So we're going to, I'm going to pass it to my colleague Alicia, and she's going to share a little bit about our blueprint for kids.
Thanks, Carly. And I believe you all should be seeing a PowerPoint now. There we go. So I'm going to go over today a few different things. I'm going to go over several of our policy priorities that are on the blueprint this year. And I'm going to start with priorities that have not yet been filed as bills, and then we're going to move into those that have been filed as bills so that you can go ahead and follow those and take action on them. But first, for those of you who are not as familiar, I'm going to go over a little bit of background of what the Blueprint for Kentucky's Children is. So we are a coalition of over 100 statewide partner organizations. And so this includes the hosts that are here today, as well as many of the attendees of today and all the events this week, representing nonprofits, public and private organizations. We speak with a common voice to create brighter futures for Kentucky's kids. So every year, the Blueprint partners have a policy agenda that we are promoting throughout the legislative session. So the Blueprint stands, as you can see here, on 3 pillars, and those are thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. So as the Commonwealth has worked to overcome the impacts of the COVID-19 pandemic and address systemic racism, these policies that I'm about to go over can be implemented during this legislative session without being included in the state budget. So as I mentioned, none of these have been filed as bills yet, but these are our priorities that have not been filed. So the first one is to extend the statute of limitation for misdemeanor sexual abuse cases involving minors. So right now, the current statute of limitations is 5 years after the victim's 18th birthday. So if this bill were to be filed and passed, it would extend that to 10 years after the victim's 18th birthday. The next one is to eliminate the clergy penitent privilege exemption from the child maltreatment reporting law. So this is to ensure that any disclosures or suspicions of child abuse and neglect are reported to the proper authorities. The next one is to eliminate the chain of command reporting procedures in public and private agencies for the child maltreatment reporting law. So what we've seen in some instances is that the internal policies of agencies mandate that workers actually report disclosures of abuse to their supervisor, and then the supervisor might launch an internal investigation before it gets reported to DCDS or the police. So this bill would just mandate that whoever actually received the disclosure would be the one that has to report it to the proper authorities. Next, we have established a minimum age threshold for when young children can have complaints heard in court. So right now, children of any age in the state of Kentucky can be complained on and then have those complaints brought before a judge. So in 2020, we know that the youngest child was 8 years old when this happened, and establishing a minimum age would really just increase opportunities for us to connect young children to community-based resources instead of sending them straight into the juvenile justice system, which we know can be so hard to get out of. Next, we have a way to minimize the impact of parental incarceration on children by holding their parents accountable in ways that prioritize substance use treatment and community-based alternatives to their incarceration for certain offenses. So Kentucky has the third highest rate of parental incarceration in the nation, and we know this has a profound impact on their children. So this is just a way to help reduce that negative impact of having an incarcerated parent while still holding parents accountable. And then the last one we have here is to amend the local planning and zoning laws to allow regulated home-based family childcare options to safely serve more children in their community. So home-based family childcare options are those childcare centers that are actually operating out of a home instead of like a freestanding facility. So they do still have regulations in place, but there's a lot of burdensome requirements for them to get regulated to be able to provide this care. And so we know in the past 10 years that Kentucky has experienced a dramatic decline in the number of family child care home providers that are available. And so this would change some of the planning and zoning requirements to make it easier to get the requirements to be able to provide that care in your home. And this would help to eliminate the child care deserts that we see across the state. And so we know this is so important following the COVID-19 pandemic and as it's ongoing, as many people are struggling to find childcare in their areas. So those are all those are all of our policies that are not yet filed as bills. We hope we filed soon, as the session just kicked off for the second half yesterday. So now I'm going to pass it over to Courtney Downs, who is going to go over the bills that are already filed.
All right, thank you, Alicia. And as she said, I'm just going to take a few minutes to kind of go through the priorities that have been sponsored by a legislator. Some of them have already been assigned to a specific committee. So these are great ones to reach out to your legislators about, and ones that we hope to see continuing to move through the legislative process this year. So the first ones are House Bill 42 and 54. So both of these would allow state employees to access 12 weeks of paid family leave after the birth or adoption of a child. There is bipartisan support for this issue. Representative Raymond, who is a Democrat, sponsors House Bill 42, and then Representative Nemes, who is a Republican, sponsors House Bill 54. And as of right now, the only difference between the two is that House Bill 54 says that the 12 weeks of paid family leave have to be used within 24 weeks of the birth or adoption of the child. That's it. So we are advocating for this because we know that paid family leave allows families to be there in the important first moments in their children's lives. There are proven short and long-term health and well-being benefits, as well as proven returns on investments for employers. And also importantly, Black and Hispanic workers currently are less likely to have access to paid family leave than people who are white. So improving access to this benefit would boost family and economic stability for every eligible family. The next one is House Bill 147, and that one is sponsored by Representative Mosher. She is a Republican, and it's co-sponsored by Representative Bojanowski, who is a Democrat. So again, there is bipartisan support for this bill. And this bill would allow city and county governments the option to regulate the use, sale, and distribution of tobacco products, including e-cigarettes. And also I want to point out that Senate Bill 81, which is a companion bill, was filed in the Senate by Senator Julie Rocky Adams. So currently, both bills are identical. So what that means is that if they both make it through their respective chambers without any changes made, then the bill will immediately go to the governor's desk to be signed. And here's a couple other things that we know. City and county governments see firsthand how effective tobacco control policy can improve the health of their constituents over time. So when they're given that discretion, they can respond more appropriately and quickly to the local needs. They can tailor ordinances that meet those needs, and they can develop effective enforcement measures. But currently, state law prohibits or preempts local jurisdictions from enacting stronger tobacco control measures to reduce tobacco use. So what we're talking about here is local control. So some examples of what that could include are setting standards on tobacco retailer density in neighborhoods, or setting like buffer zones between tobacco retailers and schools or playgrounds. We know that children are much more likely to smoke if they live or go to school in a neighborhood with high tobacco retailer density. And we also know that tobacco retailer density is higher in urban neighborhoods, neighborhoods with higher percentages of Black residents, and then also low-income neighborhoods. So in other words, kids who are low income or Black are disproportionately at risk of using tobacco. Next, we have Senate Bill 36, and this one is sponsored by Senator Whitney Westerfield, and it is currently assigned to the Judiciary Committee. And Senate Bill 36 would expand judicial discretion when deciding whether or not to transfer a case to adult court when the youth is at least 14 years old, and a firearm is involved. So right now, KRS states that judges are only allowed to consider the age of the youth, whether there was a firearm involved, and whether a felony was alleged to have been committed when deciding whether or not to transfer the case to adult court. The gun doesn't have to work. It doesn't have to have been discharged. And if there was more than one youth involved, even if they weren't in possession of a firearm, they'll all be held to that same standard. So under any other circumstance, using any other weapon that you can think of, judges have full discretion and use a list of factors to help in their determination. So these factors include the seriousness of the offense, the maturity of the child, their previous record, what's in the best interest of the child and the community, public safety, and a few other things. So if this bill passes, judges will be afforded the same discretion in cases involving firearms as they are in any other case. And then the last one, finally, is House Bill 192, which is the budget bill. And that is sponsored by Representative Petrie. He is the chair of the House Appropriations and Revenue Committee. And this would enact a continuation budget that, among many other things, will impact children's healthcare coverage, their healthcare, education, safety. And for those who don't know, a continuation budget is exactly what it sounds like. They are trying to continue the one-year budget that was implemented in 2020 into 2021. And the Kentucky House and Senate have both passed House Bill 192, and now the appointed members from both chambers will participate in something called a conference committee, where they can negotiate the details of the state budget before the final gavel next month. And we have a detailed priority checklist that we can share with you, but I also want to give you a couple of the highlights quickly. So one thing that COVID highlighted is the need to prioritize broadband. Currently, Kentucky is 40th in the nation. So we are advocating for funding for that infrastructure because we know how essential it is for school, for medical, with telehealth. We also want to ensure that there's dedicated funding to implement the expanded care services policy to support student health. We want to sustain funding for the Family Resource and Youth Service Centers, or FRISCIs. And then we also want to prioritize sustained funding for kinship caregivers and fictive kin caregivers. And so what this means is two things. One, we're ensuring that every eligible kinship caregiver knows about and receives the relative caregiver support benefit, which is a one-time stipend that can be used to purchase necessities like school supplies, formula, bedding, or clothing. And then secondly, we're ensuring that front-end preventative services like respite care are always available to kinship and fictive kin caregivers whenever they need it. And then finally, I just want to go over a couple of our child welfare budget priorities. And so that includes strengthening funding for programs like K-STEP and START. We know that substance use has played a significant role in over half of the cases involving kids who were removed from their homes. So these programs are proven effective in helping parents achieve sobriety while also safely caring for their children. And it's also important to point out that for every dollar that you spend on the START program, Kentucky as a state will save $2.22 in out-of-home care costs. We want to continue funding for the HANDS program, which is an evidence-based in-home visitation program that increases adequate prenatal care. It's proven to lower the rates of preterm birth and low birth weight, and it also lowers incidences of child abuse. We want to increase funding for forensic services for children who experience child abuse and neglect, specifically for the pediatric forensic teams that are based out of the University of Kentucky and the University of Louisville. And then finally, we want to ensure that the safety net programs that exist, like SNAP or WIC or KTAP, aren't modified in ways that will keep children who need those benefits from receiving them. So I know that's a lot of information to give all at once, but we do expect that some of these bills will have committee hearings relatively soon. So keep looking out for those and using our bill tracker as well. But right now, what I want to do is to bring back a couple of our partner co-hosts to take a deeper dive into one of the policy priorities and then one of the budget priorities. So I will start with you, Dr. Howard. One of the budget priorities that I just talked about and that you were kind of alluding to a little bit in your introduction is increasing the funding for pediatric forensic services. So I'm just going to assume for a few minutes that people on the call may not know as much about what you do. So I just wanted to give you a few minutes to talk about what you do, what your team looks like, who you work with, and if there's anything else that you think people should leave this call knowing.
Yeah, and I think it's the day in the life, but I think what gets hard is that none of our days are the same. And you can't ever make protocols about our type of cases because no two cases the same really. And so what I am is, I'm a child abuse pediatrician. I trained at the University of Louisville. And so up until 2015, all services were provided by the University of Louisville. And so what that meant was if anybody had a question about any medical finding in child maltreatment, whether that was types of fractures, head bleeds, bruising, anything like that, they had to go to the University of Louisville and ask those questions. It would be really hard on cases because as you guys may or may not know, there's 2 level 1 trauma centers in the state of Kentucky. So if you're going to have the really serious case of child maltreatment, they're going to go to UK or U of L. And when we were all at U of L, it made those cases at UK incredibly hard to work with because we weren't being able to look at images live. We weren't interviewing families, those types of things. So I came to UK in 2015 and started the second program for the state. And so now we do at least have 2 programs statewide. Annually, the 2 programs combined are probably involved in about a little over 2,000 cases per year. And when we look at the numbers, of course, there was over 20,000 cases of substantiated abuse in Kentucky. And so we're only really touching a small portion of those cases. And secondly, not even all the cases we see get substantiated. So it's even a smaller number than that. And I think one of the big things, so what do we do? Anybody can call us with questions on a child. So we get consults from hospitals, primary care physicians, nurses, DCBS is a big referral source, law enforcement, and even families can call us and ask questions if they have concerns for child maltreatment. And they kind of tell us what their concerns are, and we do an initial triage. And so, for instance, if we have a 3-month-old, they're like, oh, this 3-month-old has a bruise on their stomach. What should I do with this kid? We make recommendations about where that child should go and what type of workup should happen. We go and interview families. And this is where I think a lot of people really, even in the medical field, don't understand. And so when any other subspecialty in pediatrics gets a new patient, they schedule that appointment for 30 minutes, an hour for the really complex ones. And that should be time to see the patient and finish a note on them. Whereas in an hour of time, we've really just established a minimum amount of information on a lot of our cases. And so we do a pretty in-depth multidisciplinary interview. So we have a clinician, a medical clinician, but we also have a social worker, an LCSW that does an extensive psychosocial for the family. because even if we don't diagnose abuse, we know in Kentucky, the number of families that have high risk factors involved with them. And so we don't want to just say, oh, well, you're not a victim of abuse, so we're done. No, we want to help all families in the state of Kentucky because we want to prevent abuse just as much. And so once we do the initial assessment, our case is really just beginning. We coordinate the multidisciplinary team, the work with DCBS and law enforcement. So I always equate it to bringing together all the puzzle pieces. And honestly, that's a time-consuming one because no parent comes in and says, oh yes, I threw the kid here 2 days ago, or I did this, or I did this. No, they come in and tell us a dishonest history first. And so we have to work with our community partners to start to bring all the puzzle pieces together. And, I kind of equate it to, you see a blurry picture at first, but as each of our put in our input into it, that picture becomes more and more clear about whether or not we think a child was a victim of maltreatment. That can take a pretty long time, depending on how fast the investigation is going and how many people they need to talk to and all of that. And then we submit a report, so a final impression to the court. Sometimes that can, yes, take 30 minutes to an hour. However, I have spent 40 hours writing a report on one kid because it had so much information. There's there's chart reviews, everything goes into it. And what doesn't really come across and that's really hard in the medical field is that's not really billable time. And if you work in the medical field or have any experience in the medical field, non-billable time is really hard to get support of. And so we rely very heavily on gifts, grants, those types of things for a lot of our services. Once we're done with the report, then we do testify as experts in court, both family and criminal. And a lot of us know the court system and know how long those cases can take sometimes. I think I've set 10 hours waiting to testify for it to just get continued to the next week. And so it's a very time-consuming process, but one that is very needed. Prior to this, CPS wouldn't have that person to go to ask those additional questions. And so whenever, I was sitting in a meeting at one point at UK prior to joining the team, and CPS was on the phone. It was their child protective team. And they would ask a question and not a single physician in the room would want to answer the question because nobody wants to be that person that gets subpoenaed to go to court. And so now this opens up those communications. The Attorney General stressed the importance of the multidisciplinary investigations in these types of child maltreatment cases. And then again, the work is only just beginning. We want to support the family. And I say that because, we had like a 4-month-old child last week that was a victim of abusive head trauma that dad confessed to. And so luckily dad confessed and that allowed us to be able to know who. But then we needed to wrap services around this 19-year-old mom that is dealing with a husband that just said that he almost killed their child. And she has suffered through trauma throughout her life. So we need to wrap her in services so that she can be a strong caregiver and support that child like that child needs to be supported. So that's why I think that it's critical for us to be able to do that extensive psychosocial evaluation, have social workers that can provide that crisis intervention when needed, and then refer to services that are in our community when we aren't able to reach those ourselves. And I think that that's one of the things I love about Face It and Face It Bluegrass is that it brings together all of these community partners to be able to know who to go to and who to call when we need to connect families to these services. So Dr. Sprang, on a regular basis, we refer children to that. In Lexington, we have the Chrysalis House, like Jennifer mentioned as well, for substance abuse. The domestic violence shelters are part of our partners in the community, the Children's Advocacy Center. And so we are separate from we aren't part of the Children's Advocacy Center, but we do have physicians that provide service at the Children's Advocacy Centers for victims of sexual assault. And so we have a very strong collaboration, but it's different types of services still. And so I think that's one of the biggest things is that we are different, but we are kind of part of the same team. And so a lot of people don't realize that. And then we encompass all types of child maltreatment. And so we're involved with the severe physical abuse, typically the neglect, or usually the more severe neglect cases that are near fatal neglect cases, those types of things. I want to be involved with a lot more than what we are. Unfortunately, there's only 360 child abuse pediatricians across the country. Kentucky has 5 practicing child abuse pediatricians. And so that has about 1 per 4,000 to 5,000 substantiated cases of abuse per child abuse pediatrician. That is well beyond what we are capable of doing to be able to practice and efficiently. And so we do need additional services in our state. I'm on call about 22 days per month, and that can be very challenging. A lot of us don't have much lives outside of this, and it can be hard because we all know what these cases are like. As Dr. Spring mentioned, secondary trauma in this field is a huge component. So we do utilize forensic nurses and nurse practitioners to help kind of expand our services beyond what our capabilities are at this point. And we're still just barely touching what needs to be touched. So we need to be able to bring in additional partners and physicians. And right now, I think physicians are the rate limiting factor in what we're able to expand services on. I think that kind of, it's always hard to sum up in a small presentation the extent of the work that we do. I do also serve as the consultant in child fatality reviews across the state and just injury prevention in general, because I think all of our goals is that we want for children to leave safe and healthy lives, and that's multi-generational, and that is all encompassing of multiple factors. And so we do have a lot of tentacles out there, and we're still learning from all of our community partners about how do we improve what we're offering our families. And I'm going to kind of stop there and open up any questions and see if there's anything else anybody wanted to hear.
Yeah, thank you so much because I know it's not easy to try to fit the work that you do, that your team does, into 10 minutes, and I could absolutely just keep this conversation going because I think so highly of you and Dr. Curry and your teams and everything that you all are doing. And I think it's what you shared just absolutely encapsulates why we need to be advocating for these expanded services and just how important you all are to children and to families across the state. So thank you so much for coming here and for everything that you all do and for educating all of us a little bit on the important work that you all do. So thank you so much, Dr. Howard. And now we're going to shift gears a little bit. And I am going to bring Jennifer Hancock back in. And one of the Blueprint policy priorities that Alicia had talked about earlier was on parental incarceration. We want to, obviously prioritize substance use treatment and community-based alternatives. Senator Rocky Adams talked a little bit about the dignity bills at the rally this morning, and I know you worked closely with her on those bills and have a connection to this issue, of parental incarceration through the Freedom House. So can you just talk a little bit about, any components of the bills that you think are important to talk about, the impact that it can have, and why this is an issue that we should care about as advocates for kids?
Yeah, well, first, I cannot say enough about Senator Rocky Adams and her leadership on behalf of Kentucky kids and families. She spearheaded Senate Bill 133 a couple of years ago, I guess 3 years ago now, and we worked closely with her. I sent a picture, and I think we're going to be able to share it with you all, which I think summarizes the impact of this bill. If we can blow that up a little bit so you can see it. This is a photograph that we took 2 years ago. This was at the Family and Children Place Child Abuse Awareness Rally. And Senator Rocky Adams was there, and I was there with a bunch of our Freedom House mamas here in Jefferson County. And so I asked Senator Adams to come over and meet these young women and explain to them that she was responsible for the dignity bill. They immediately embraced her. One of them, the young lady that I've got my hand on her shoulder, she immediately started crying and she said, I just got released from jail because of the dignity bill last week. I'm getting ready to deliver my first child, my baby daughter, and I would not be delivering her at Freedom House if it weren't for you. And so we took a moment to capture this just amazing experience of our clients getting access to the policymaker that enabled most of them to come to our Freedom House program. What was interesting about this bill and the immediate impact it had is that we went from having about 50% of our residents come out of jails and prison, and about 50% of our residents come from other sources, DCBS referrals, hospital referrals, OB referrals, self-referrals. And after the dignity bill passed and went into law, we found ourselves receiving referrals from jails across the Commonwealth. So many jailers who had pregnant women that they simply did not know what to do with other than to continue to incarcerate them, and wanted, and I was so pleasantly surprised by this, that our corrections officials want solutions like the ones we can provide. And so we immediately were inundated with referrals from jails across Kentucky. Similarly, our experience on the ground in Clay County has been that about 80% of our referrals so far have come from jails. The very first woman that we admitted into Freedom House Clay County on March 13th of 2020, she delivered our first healthy baby on April 1st. So just a few weeks later, and she stayed in jail until the end of her pregnancy, until we opened, and then they immediately released her to us. And what we know is that by avoiding the disruption and the trauma of having baby go somewhere else for that first critical period of life is so essential to ensuring that bonding and attachment occurs. We've worked with many women who did not have the luxury of delivering from Freedom House, that delivered from jail, and went through the real trauma of experiencing the shame and humiliation of showing up in shackles and showing up in clearly attire that made it noticeable where they were from, to now not having that with the Dignity Bill, but there's so much more that the Dignity Bill 2 accomplishes in terms of extending the recognition of postpartum being 6 weeks after delivery, ensuring that social workers are working to place women in treatment, and making sure that women are aware of all of their options. Unfortunately, and as much as we try to get the word out about solutions that we provide, and the fact that you can bring your children to treatment, which for some women, that is the game changer. Their ability to bring their kids into treatment is the motivation that they need. So that can be a huge selling point, and just making sure that they know that we're available. So despite our efforts to get the word out, we know that we are still a little bit of a best kept secret. So what I hope we can accomplish by being a part of today's call is to share in your communities the message of what VOA is doing with our Freedom House programs. We have 3 in Jefferson County, 1 soon to be 2 in Clay County. We're in early discussions with Owensboro and maybe Northern Kentucky about expanding our reach to 2 new markets, and with support from a couple of private investors who recognize that when we keep families together and heal them together, not only does mom do better, but this becomes a powerful primary prevention program for kids, because they get to learn about the trauma of substance use disorder in an age-appropriate and developmentally appropriate way. I mentioned I'm an LCSW and started my career doing this work. Well, it was 6 years ago that my family found itself right at the epicenter of the opioid crisis and the intersection with corrections and this public health crisis that we are all in. And so I now have 6 years of lived experience of knowing how critical it is that women have immediate access to treatment, and that treatment is absolutely something that can help women get on a path to long-term recovery and really change the trajectory of kids' lives. One last anecdote. This past weekend, I went downtown to our administrative office at 4th and Chestnut in Louisville, and I opened up our conference room for a 23-year-old young man and his wife to host their baby shower. They now live in Campbellsville, and they wanted to have a baby shower for friends and family in Louisville, and they couldn't figure out where to do it that was available with social distancing and everything with the pandemic. And so I offered our VOA conference room. And the 23-year-old was someone that I met as a first grader, and he was living with his mom at Freedom House when I first became familiar with Volunteers of America. He started first grade with us, and now he's about to become a father of his own. And it makes me so emotional when I think about disrupting this intergenerational cycle, and how confident I am that his daughter, her name is Tatum Brielle, and she's due next month, how she will never know that her Mimi, Tara, who was served by Freedom House, struggled with substance use disorder, and how hard it was for her dad as a little boy to find his way to safety. And he's going to provide the safety and stability that she deserves. And now Tara has over 15 years of sobriety. Collie is a stable, healthy, mature young man, mature beyond his chronological years. And so to see this next generation is just so powerful, and keeps us really working hard at VOA to work as quickly as we can to make sure that everyone has access to our services.
Thank you so much, Jennifer. That was such a great testimonial to what you all, the important work that you all do at Freedom House and VOA. So thank you, Jennifer, and also to Dr. Howard for giving us just some additional background information on a few of the Blueprint priorities, and of course what they mean for kids. So as we wrap up
Carly,
today.
can I just add too? I think somebody said we need a Freedom House in every county. I went to a CFR, so a Child Fatality Review meeting in Clay County like a month before they were opening, and you should have heard the excitement about that opening in that room, because it actually was a death of a mom that of an overdose death when she was pregnant, and so they were just so excited about your all services. And so I agree, whatever, I think that there needs to be something like this for every county in Kentucky.
Yes, absolutely. So again, as we wrap up today, we wanted to take a minute to hear from Children's Advocacy Week's signature sponsor, Aetna Better Health of Kentucky. And as some of you may have heard, Aetna Better Health is now serving all kids in state care through the Supporting Kentucky Youth Program. And we have a short video from Aetna Better Health with a little bit more information.
Hello, fellow advocates. We are so excited that it is Children's Advocacy Week. We are delighted to be with you here today. I'm Kelly Poland. I'm the Executive Director for the SKY program here at Aetna Better Health of Kentucky. And at Aetna, we are so excited about this week and really excited about the rally, because that's when hundreds and hopefully thousands this year, as we go virtual, will come together to show our collective support for Kentucky's kids and families. We also know there are not a lot of event opportunities for our kids to share the same stage with Governor Beshear and our House and Senate leadership. Aetna knows there's no better way to make connections with advocates who care about kids than this week. And an event like this is especially important this year, given the pandemic and the systemic inequities that we see, particularly with our vulnerable kids and families in the state. And furthermore, Aetna Better Health is honored this year to support the critical work that we know Kentucky Youth Advocates does to help the Commonwealth in their commitment, again, to meet the needs of our children and family in the state. This year is extra special for us at Aetna because we were selected to manage the state's new Supporting Kentucky Youth program, also known as SKY. And this really means that children and youth in out-of-home care, including former foster youth, youth who are placed in kinship or relative placements, Medicaid eligible youth in the juvenile justice system, and children and youth in out-of-home care and adoption assistance youth began receiving their Medicaid coverage through Aetna starting in January. And in addition to covering Medicaid benefits, we are going to be providing a high-touch approach to care management for this population. And this really helps children and families navigate the systems and make it easier for them to get the resources that we know that they need. Our care management team is going to be helping Kentucky's children and families find local providers, schedule appointments, and even help these members get rides to and from their medical appointments. And we will also be providing extra bonus benefits like cell phones, laptops, and wireless plans to some youth so that they can maintain those very important connections to their support system. Members in SKY can also get other extra benefits to set them up for success, like GED prep classes, job training, life and financial skills coaching, and much more. Plus, we offer a few other helpful extras like our duffel bag program that's full of essential and fun items and a surprise birthday box that includes, well, we don't want to really ruin the surprise for you all. In addition to these extra benefits, we will be working really closely with the families that our youth and providers and others who are involved in these children's lives work with so that we can help equip them with the tools they need so that together we can achieve the best possible outcomes. We will be providing free training to the stakeholders that are in the child welfare and juvenile justice systems. Some of our free training includes a trauma-informed care overview, which really provides an overview of the components of trauma-informed care and the impact of adverse childhood experiences. And another training I get really excited about is our Human Trafficking 101 training. In this training, we're really helping our participants understand what human trafficking is, what resources are available, and help them learn how to meet the complex behavioral health and support needs of this population. If you are interested, upcoming events and opportunities like these that I just mentioned will be online at www.aetnabetterhealth.com/Kentucky/event. Finally, I just wanted to mention one of the most frequently asked questions that we've been getting as we're implementing this new model here at Aetna Better Health with the state of Kentucky is really about existing relationships with providers who are not enrolled with Aetna. The SKY program is really focused on engaging our members and their networks of support. And we really appreciate the importance of SKY members' established relationships with their providers. So we would like to help maintain that relationship so the SKY eligible youth can access all of these wonderful supports and services that SKY offers, but also still maintain that invaluable relationship with their providers. So we want to let you know that caregivers or providers can reach out to us directly and reach out to our SKY provider relations team to get enrolled in our network so that the providers can continue to see our members. Our contact information is going to be on a one-pager and in our mobile app, and we will be sure to share that with you. I'll drop our phone number real quick. It's 1-855-454-0061, or reach us by email at kyproviderrelations@aetna.com. And there's no need for a special contract to provide services to SKY members. All participating Aetna Better Health of Kentucky providers are available to see our SKY members under their existing contract with Aetna. Again, we're so excited and honored to be partnering with KYA and to be partnering with all of you. I am certain that we are going to have a very powerful Children's Advocacy Week. Thank you for this opportunity to spend some time with you today.
All right, and thanks to Aetna Better Health for providing us with that information. And so you may be asking yourself, what do you do with all this information we just laid out in front of you? And the answer is take action. You know, contact your legislators, let them know how important these issues are for the kids and families in Kentucky. And don't forget, we have some tools that you can use to stay connected throughout the remainder of Children's Advocacy Week, as well as the General Assembly. We have an app that you can use during this week. You can find it online, and it just kind of helps lay out all the different programs that we're having and forums to give you a little bit more information about the blueprint. We all are also putting all of these recordings on our YouTube channel, so you can check those out, and some are also being added onto Facebook. Follow us on social media as well. And finally, you can look up your legislators and follow our bill tracker on our website at kyouth.org. So be sure to check all of that out as well. So again, special thanks to our co-hosts, Dr. Howard, Dr. Sprang, and Jennifer. Thank you all so much for joining us and giving us your perspectives. And thank you for everyone else for joining us today. We really appreciate it.